Thank you so much for welcoming me to participate in your conference and share a little bit about Pink Ribbon Girls with you. First off, I would like to go over my agenda of what we'll cover today. First, I will share a little bit about my personal cancer journey and how I found Pink Ribbon Girls and what my role is with them. Then we will dig in and talk a little bit about Pink Ribbon Girls. I'll give you an overview, and then referring back to the title of my talk today, How We Grew During a Pandemic, we'll dig into some of those topics. And then we'll wrap up with what we call our big audacious goal as an organization, and then have time at the end for questions. So this is me, Jan Middleton, the Director of Peer Support and Education. Up in the top left there, you can see my family. First off, we have my daughter, Jillian. She is currently a sophomore at the University of Alabama, and she is studying PR and advertising. And there's my husband, Brett. We just celebrated 30 years of marriage, and also just have to say he's was my caregiver during my cancer journey, and just can't say how grateful I am to have him. And then on the right is my son, Tyler. He's my adventurous spirit. He just finished a summer working as a guide in Alaska and is now on his way to spend the winter in Alaska. So my adventurous soul there. But again, as the Director of Peer Support and Education, how did I get there? It definitely, what led me there was my own cancer diagnosis. And so you see the picture there with me with a pink wig on in the center, have my port, I'm getting chemotherapy. And so to go back a little bit, I would start with that my mother was diagnosed on September 11th, 2001. She was diagnosed with early stage breast cancer. And at that point, I was 30 and I had two older sisters. And so it was recommended that the three of us start doing mammograms earlier than the 40 or 45. That number kind of changes for recommendations. So I would go for a yearly mammogram. My mom was doing well. I really didn't worry too much about breast cancer. I just did my annual mammogram. And then in 2007, I was working in the lighting and electrical industry, and I had been carrying around some really heavy lighting fixtures on a business trip. And at the end of the day, noticed that I was having some pain in my right breast. And it didn't really scare me too much, but all of a sudden I could hear this small little voice in the back of my head that was my mother saying that her breast cancer hurt when she was diagnosed. And of course, we hear breast cancer doesn't hurt is one of the myths that we hear. But it resonated with me that my mom had breast pain, and now out of nowhere I was having breast pain. But I thought, well, maybe it was hormonal, and I didn't panic. Again, I was out of town, so waited until the next month. And around the time of my period, I started noticing I was having that pain again. With a self-exam, I was not able to feel a lump, but decided to reach out to my family doctor. They said, go ahead and come in, let's just check it out. He was not able to feel a lump, looked at my records and said, you're just a few months from your next mammogram. Why don't we just go ahead and do one early, just to, put your mind at ease and move on. So on a beautiful Friday morning in September in 2007, I came downtown Cincinnati and had my mammogram. Again, I was not scared. I don't know why I wasn't nervous, but I wasn't. And then the tech walked back in after doing those first images and said, well, we need to take a second look and do some different images. And so then that sinking feeling starts creeping in. That's not necessarily a good thing. So did the second round of images, and then she came back in and said, I'm going to ask you to come downstairs with me and meet with the radiologist. That's when the bottom fell out. I knew that was bad, and I was there by myself, and just pure panic is all I can say. So I walked in a room with the radiologist. He had my images from January and then the images that they had taken on that morning in September. And right away he said, I have no doubt that I'm looking at breast cancer. And I was angry. I was like, you can't say that until I have a biopsy. You can't just assume that. And I looked at the images and it was pretty scary what we were seeing. But I was very fortunate. they were able to get me in for a core needle biopsy just maybe an hour or so later. It was a Friday afternoon. The surgeon, I call him my angel, told the nurse it's Friday afternoon. I don't want her to wait over the weekend for these results. I want her to have an answer today. Rush this through the lab. And he himself called me at 6 p.m. and said, I'm sorry, but this is confirmed to be breast cancer. And your world just falls apart. I don't care who you are. I don't care what type of cancer it is. When you first hear those words, you have cancer, there's so much unknown. You don't know if you have early stage cancer. You don't know if you have cancer all over your body. I was 39 years old. I felt so healthy, but you just don't know. And I was so afraid. My kids that I showed you there in the beginning were just 4 and 11. We had just relocated to Cincinnati from Atlanta for my job in the lighting and electrical industry. So I was starting a new career with a new company. We had no friends. We had no family within 4 hours of where we were living. And, you go into this whirlwind of appointments and the unknown. And so then they said, yes, you're going to need chemotherapy. I did a double mastectomy, 4 months of chemotherapy, and then also needed to have my ovaries removed. So it was about 18 months total of treatment. And again, we were alone. We didn't really know anybody. But what happened is this community that we live in here in Cincinnati just showed up for us. People that we didn't know started showing up at our doorstep, introducing themselves, of course, bringing a beautiful casserole or what my kids remember, warm chocolate chip cookies, helping get the kids to sports practices, inviting them to play dates. What we thought is that we were completely alone. And what we found is that God surrounded us with the most amazing people that took care of us and made sure that we never felt alone. And I can remember when I first started chemotherapy, again, it was in the fall. I would always try to be so strong for my kids, right? I call it the mask. You would get up, put the mask on with the smiley face. I'm good. I can do this. And when the kids would go to bed, I would go out and walk. And I would pray and I would walk and I would cry and I would pray. And I remember praying to God, if I survive, if I can beat this, I promise that I will find a way to pay forward the kindness that our family is receiving at this time. God, you are taking such amazing care of us, surrounding us with amazing people. And I made a promise right then, I've got to find a way to pay this forward. Like I said, I finished treatment and right away started getting involved and volunteering. I had a friend that encouraged me to do a team for the Komen Walk. And that just lit a fire in me that I wanted to raise money. I wanted to help, find a cure. I wanted to help other people going through this. And I was actually at a conference in Atlanta, believe it or not, and met the CEO of Pink Ribbon Girls. She wasn't even the CEO yet. And she was just starting to think about forming Pink Ribbon Girls. And she said, one day you're going to work for me. And so in 2000, I started volunteering for Pink Ribbon Girls first. And then she invited me to become a board member. And then in 2014, this was pretty scary. I left my 29-year corporate career in the lighting and electrical industry and became a contract 20-hour-a-week employee for Pink Ribbon Girls doing fundraising. My son was just going into college, and I said to my husband, I know this sounds crazy, but this is where my heart is telling me this is where I'm supposed to go. And I know God is going to help us figure this out. We'll figure out how to pay it, how to pay the bills. We're going to be able to do it. So again, I started there in 2014. I've done various roles. And then at the end of 2019, the newly created role of Director of Peer Support and Education. And so that is my role today within the organization. And you can see a couple pictures here with different survivor celebrations that I get to be a part of, different events with our survivors. So what do I do as the Director of Peer Support and Education? We like to say that Pink Ribbon Girls has created a community where our patients and survivors can connect with their peers and where it is safe to ask any questions or share their personal experiences. If any of you are cancer survivors or you've been through really any type of chronic illness, you know that you can be surrounded by the most amazing family, friends, church, but it can still be a really lonely experience because those around you don't really understand your fears, the side effects that you're dealing with. When you move into survivorship, those things still exist. And so your family and friends are like, move forward, you're done. And you're still in a really, sometimes it can be a really dark place. And so we create this environment, this safe space for survivors to connect with their peers so that they can participate maybe in our weekly virtual events. We can bring in guest speakers that can discuss all different types of topics such as side effect management, stress management, family issues, sexual health, just a wide variety of topics. And they, again, have that safe space to ask maybe those uncomfortable questions. We also will host events that are group specific. So I host an event for monthly metastatic for those living with stage 4 breast cancer. Again, those are very unique circumstances. We host a monthly gynecologic cancer group. It's a very small group, but they're able to connect only with those with gynecologic cancers, people that they really have similar side effects, similar treatments with. We do something called a patient survivor lunch break. They can just jump on for an hour and ask any question with this amazing, what I call the panel of experts, which are other survivors. I also, as the Director of Peer Support and Education, work with each of our regions. So we currently are serving in Cincinnati, Dayton, Columbus, St. Louis, and San Francisco. So I work with our staff there to host in-person events when it's safe. COVID has obviously presented a lot of challenges, but we are getting back to hosting those in-person events. So they're like social events, or we can do, you can see there I talk about an annual survivor celebration. We do that in every region. We, again, will work with hospital partners and do educational seminars. So that really keeps me busy. And, I get asked a lot of times, how do you do this? How do you go from being a survivor, having your own fears, lingering fears as a survivor, but then deal with this day in and day out? And it is hard, I will tell you, I love the people that we serve. Those that I get to meet and spend time with in person, even become friends. I've traveled with them. We do birthdays together. We do things outside of work. And with cancer, we know that we are losing people continually. And that's really hard in our job to lose those people. But the blessings that this job has brought into my life, I know that God has put me here. This is where I'm supposed to be. And so I will say, it is a blessing that these patients and survivors allow me to walk beside them during one of their most difficult times in their lives. And so, yes, it's hard, but I would not change it for the world. So let's move on and talk a little bit, give you an overview about Pink Ribbon Girls. From the moment of diagnosis, the client is overwhelmed and scared, just as I talked about, right? That 15 years ago, when I was diagnosed, that was those first feelings: overwhelmed, scared. And, as I said, my first thoughts were towards my children. Were they going to lose their mom? Was I going to miss those milestones of seeing my daughter even start kindergarten or seeing my son graduate? Who's going to take care of my family is what so many people start thinking of in those beginning moments. And we like to say that PRG is the answer to that. Just as cancer is unbiased, we are committed to serving everyone diagnosed with breast and gynecological cancer. So Pink Ribbon Girls' mission is to provide healthy meals, rides to treatment, house cleaning kits, and education and peer support to breast and gynecological cancer patients and their families, free of charge, independent of age, stage, or socioeconomic status. So I'd like to take a moment and share a video with you and let you hear from our clients.
The journey for me started back in February of 2020. I felt a lump. I kind of checked it a few times, here and there over the next couple weeks. But then I started to feel something. It wasn't really pain, but just something kind of strange. And I thought, okay, I'll just go get it checked just to make sure.
I was getting ready for work and I started to spot, and I thought, well, that's not normal. And thankfully I followed my gut that day and said, call your doctor.
I'm a gynecologic oncologist, so that means that I treat cancers that come from, call it the below the belt female cancers. To me, that's always the hardest part about telling someone they have cancer, is that moment right before that, when I know that I'm about to change their life.
My wife, Cindy, was diagnosed in March of 2015 with breast cancer. She went through 6 months of treatment and we had beaten breast cancer. Shortly after that, she was diagnosed with uterine cancer.
The husbands, they always try to catch my eye, like over the heads of the patients, and I can see the fear that's there.
And that's where her real battle began.
He said those words, you never, ever believe that you're going to hear, and that it really was cancer. I think I was in a daze, but I really kind of jumped into work mode.
They found a 14-centimeter growth, and the doctor knew right then that this is not good. And my diagnosis was ovarian cancer, stage 2B.
For me to have to tell my mother that her daughter has cancer was the hardest thing I was going to have to do. Then next, I had to figure out how to tell my boys.
The scariest moment was telling my son, who has had to deal with looking death in the face.
This is really challenging, I think, as a parent. I mean, even when your kids are grown-ups.
My youngest was like, well, as long as you're going to be okay. Well, I'm okay. And I was like, great. And then my oldest, he had to process it.
We were just overwhelmed, and it really brought us to our knees.
To feel that vulnerability, that's what really scared me.
Mom being sick is a whole different thing, and filling that gap of the things that knowing their family is still taken care of, I think, is actually one of the best things about PRG.
Cindy started getting rides to chemo.
I signed up for the meal delivery, and it was like magic. I mean,
They were sending them right to my door each week, and I was like, I don't believe this. So in those times when I was struggling, I didn't have to worry about cooking meals.
I have a story that I like to relate to when I hear about people who need help. And the story goes like this. There was a man walking down the street and he falls into a huge sinkhole. He's down there alone and he's scared. And just then a doctor comes by and says, don't worry. He said, I'm going to take care of you. And he writes him a prescription and throws it down the hole. And then he's still down there alone. And then a lawyer comes by and he says, I can't get you out, but I'm going to sue whoever put this hole here. And walks past. And then his priest comes by and says, my son, I'm going to pray for you. And walks on. And about 5 minutes later, his friend comes by, and he jumps down in the hole with him. And the man says, what are you doing? Now we're both stuck in this hole. And his friend says, yeah, but I've been down here before, and I know the way out. When Cindy was diagnosed, we fell down in that hole and we were on our knees, and Pink Ribbon Girls jumped down in the hole with us and they picked us up dusted us off, and found us the way out. That doesn't mean Cindy was cured. I lost her in 2020. That battle that we went through, we couldn't have done without PRG.
It's not just the meals, even though those were wonderful and needed. And it wasn't just the cleaning kits that they provided. It was the relationships.
You know, the thing that I have found the most inspiring with PRG is how women who didn't know each other like at all of a sudden are just completely united because they've shared this like life-changing experience.
There is such an unspoken bond. You can connect with somebody who totally understands. It is a sisterhood.
Sometimes I literally have to pinch myself. I can't believe that we have a PRG family that's from all of these regions that show up for these people. As my husband likes to say, we get to go to a lot of funerals, which is kind of not a perk of the job. But you know what is a perk of the job? Knowing them, seeing them love their family when they don't know how many days are left. So it just gets real clear about what's important. And as I sit here, I don't even know how I get the privilege to do this. I don't know how I get the privilege to know all of you, to watch you show up, give money, give your time, and love on our clients, because that really is what PRG is. I look forward to the day that we're all out of business and there's a cure for cancer. But until then, I want to make sure all of our clients and those facing their toughest battle have access to our care.
Thank you for allowing me to share that video. I always say, you know, we can talk about Pink Ribbon Girls, talk about what we do, even talk about our personal experience as an employee. But when you can hear it from those that are part of our family, because we say to people, once you become a Pink Ribbon Girls client, you gain this big family, and those people are our family. So thank you again for taking a moment to watch that. So I want to go back. You heard Heather there at the end of the video speak, and so a lot of times people will ask us, how did you decide on these services, the meals or the rides? You know, so many breast cancer organizations are raising money for research. That's not something that we put our funding towards. So I'm going to give you a little bit of the backstory here with these photos you're looking at. Here in the top left, a young woman by the name of Alexis and her baby Lexi. So back in 2003, through Heather and Steve, so that's Heather there on the bottom right and Steve, through their church, they heard of a young woman. Her name was Alexis. She was in her early 20s. She had stage 4 breast cancer. She knew that things were not going to improve. And she had an infant daughter. She had no family support. She was on every type of public assistance that was available to her. And she was on a mission to find a home for her infant daughter. She wanted her to have a good life, and she wanted to make that happen before she passed away. So Heather's church had gotten involved. Nobody was jumping up to say that they wanted to adopt this beautiful baby girl. And so Heather said to her husband, Steve, I think we should go meet her. And Steve said, hold on a minute. We have 3 young children. We can barely pay the bills. We're barely keeping up. What are you thinking? And she's like, let's just go meet her, because we won't adopt her, but you know, we'll help find someone. So they met Alexis with baby Lexi in the Meyer parking lot in Dayton, Ohio, that you'll see there. She came on the bus. Just as she had taken the bus home from a mastectomy, because she had no support, right? She relied on public transportation. She came out with a bright pink wig, and didn't take long before Steve and Heather knew they were going to adopt this baby and help Alexis. So you can see in the top right photo there, Alexis became a member of the Salazar family. And if you look at those 2 little baby girls sitting on Heather's lap, they like to say they're twins, which people always get a kick out of, but they're less than a year apart. And Steve and Heather helped Alexis through her final days, made sure that her baby was there with her, and did all they could do. But she knew that her baby was in wonderful hands. And I'm proud to say Alexis now is a D1 soccer athlete at Liberty University, just an amazing young woman. And so to go on with that story, as they settled into a family with 4 young children, finally on their year anniversary, next year anniversary, Heather and Steve were going to go away for a night. And for whatever reason, Heather did her first self-breast exam, and she was in her early 30s. So she was not getting mammograms, but while doing that self-breast exam, she found a lump. She was terrified. You know, she thought, my God, would God take away 2 mothers from these children? Like, this cannot be happening. She called her doctor, she got an appointment, and it was confirmed that she had breast cancer, the exact same type of cancer that Alexis had had. But thankfully, Heather's was caught early. Hers was stage 1. She went through treatment, chemotherapy, mastectomy. During her treatment at the James, she met Stephanie Spielman of the Spielman Center. And Stephanie was raising money, right, for research. She had these big ideas. She knew her days were limited. She knew she had stage 4, things were not going well. And she would continually say to Heather, what are you going to do? What are you going to do with this, Heather? Don't let my death be an excuse. I know you're going to do something great. So as Heather finished her treatment and kept thinking about, you know, as she lost Stephanie, right? That was another hard thing to go through. She started thinking about the vast difference of her cancer experience, how her church showed up for her. They cleaned their house, brought food all the time, helped take care of the kids. Her family was there, her friends. Heather was completely surrounded, never needed anything. But she would think back to Alexis, who was put on the bus after a mastectomy to go home to an apartment alone, who sold pain meds for diapers. Who was helping these people is what Heather started thinking about. And that's when she started thinking about starting Pink Ribbon Girls and offering these essential services, the meals, the rides, the cleaning, things that can just give you time, whether it's time or just being able to focus more on healing. And that's what happened in 2012. We started doing those services, the meals, the rides, the cleaning kits, and the peer support. So through 2021, we're going to jump into some numbers here. Pink Ribbon Girls has provided more than 685,000 healthy meals. These are delivered directly to the client's doorstep. We feed the patient and we feed their entire family living with them. I also want to point out that about 32% of those that we're sending our meals to fall into the category of being food insecure. So that's done through a screening process, a couple simple questions about, you know, do you have money for groceries next week? So we do that screening and we know that about 32% are what we call food insecure. Again, we're partnered with Freshly, amazing meal service company. The patients can choose, we can meet dietary restrictions. Rides to appointments. Through last year, we have provided over 43,000 rides. We work with Uber Health, and then in Ohio, we also have drivers that are employees of Pink Ribbon Girls. Again, through our onboarding process, we find out that about 28% of those that we're serving are ride insecure. That means they don't have a car, or they don't have someone that can reliably get them to their appointments. With cancer treatment, you cannot miss those appointments. You cannot miss chemotherapy. If you're doing 30 days of radiation, you need to show up for 30 days of those appointments. And Pink Ribbon Girls is making sure that these patients are getting to their appointments. Prior to COVID, we were doing a house cleaning service, and we needed to figure out what to do when COVID hit. And so we switched to what we call a non-toxic cleaning kit and a lightweight vacuum cleaner that you see in the picture there. We're partnered with Branch Basics So non-toxic cleaning kits and a lightweight vacuum cleaner is offered to everyone that is receiving our services. And then the peer support and education, which is the part that I oversee. We have had through last year more than 4,000 participants take part in our virtual or in-person peer support. And I'm proud to say that is now we've served people in 31 states, 5 areas of Canada, including 3 other countries. And so we say that our peer support is worldwide. But underneath those images, then you can also see the numbers just for 2021. The meals, just under 152,000. Rides last year were 16,000. We did over 1,100 of those cleaning kits. And then we offered more than 84 virtual and in-person peer support events. So let's talk about growth. You can, as I said, Heather took over and really kicked off those services that I've been talking about in 2012. So we're showing you the growth numbers here starting in 2013. You can see we did a 10,000 meals, which we thought that was a lot in 2013. And again, in 2021, 152,000. But, you know, we're going to dig in a little bit more in talking about how we grew during COVID. So, you know, look at 2019 and we did 108,000 meals. 2020, we increased to 115,000. 2021, big growth year, almost 152,000. Jump over to the right there to the rides. Again, you will see in 2019, 6,872, 2020 growing into the 8,000 range. And wow, big increase for rides into 2021. And we are seeing that demand continue to grow. So a little bit about, you know, full transparency on how our expenses and then also what the income looks like for the organization. We are proud to be 5-star rated. You know, it's very important to us, as it should be to any nonprofit, that, you know, you are good stewards of your donors' money. And so you can see on the left there, that 78% is spent on program services. So the programs are the meals, the rides, the cleaning kits, and the peer support and education. Management and general expenses runs about 7% for the organization. And then we spend about 15% on that fundraising events that we do. Over on the right, then you can see the income side of it. Largest part, comes from events and sponsorships, about 44%. And then grants. Anybody that's in the fundraising world or nonprofit world knows that we rely a lot on grants. And we have corporate partners, in kind, federal. That was something new for us with COVID, but you can see almost 10% last year. So that became very, very important. Individual donors. And then we also have a little bit of merchandise sales. And just again, wanted to be transparent and share that information with you. So the theme of what we were talking about today, how did we actually grow during a pandemic? We know that there are nonprofits that were, you know, doing well, and they're not here after COVID. You know, things got very difficult for anybody in the nonprofit world. There are other nonprofits who, you know, are hanging on. They might be smaller, but, you know, we're pretty proud of the fact that we were able to stay strong and to actually grow through the pandemic. So I sat down with Heather and said, you know, hey, give me your top 5 list of what you really feel helped us, you know, continue to grow during this time. The first thing she mentioned is we right-sized the organization. Probably one of the most difficult things that we did within those first few weeks. We had to reduce staffing. We had to be as lean as possible. So those of us that remained were asked to do other things. So I started, you know, taking the night shift and scheduling clients for transportation, doing the Uber. I started onboarding clients. We made the organization as lean as possible. Obviously, there were no pay increases, nothing like that. How do we be as lean, but still be able to serve people? The next thing she said, every staff member is going to become a fundraiser. So prior to COVID, if you were somebody that was doing, the ride scheduling, or you were in accounting, you were not considered a fundraiser, right? You were not on the development team. They sat us down and said, we need every person to be thinking, listening for any opportunity. We want everybody on the staff to learn how to write grants, because your number one thing is to make sure that we have income so that we can continue to serve. And so every person on our staff also took on the role of development. She said, we showed up scared and took calculated risks. Our board was really surprised when Heather approached them and said, I want to increase the number of meals that we are offering to our clients. And they were like, whoa, 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 wait a minute. You're not having fundraisers. We don't know what donors are going to do. And you want to offer more meals to these clients? And she said, yes, we know that these families, everybody's home now, right? So if a mom had 4 kids and they were getting their meals at school, schools were shut down, right? So now these kids are eating at home. That's more of a burden financially, work-wise, whatever, for the mom, right? For the patient. And so we called every client that was serving meals to, and we said, do you have the capacity to accept additional meals? Because that's what we want to offer you. And that's what we did. That was definitely showing up scared and taking a calculated risk. And Heather did a lot of those type things during that. And when she would do that and people would question her, she said, if this is going to be the last year of Pink Ribbon Girls, we are going to go out spending every last dime on these patients that need us more than ever. And that's what we did, but it worked. Those calculated risks worked. We applied for any assistance, as I mentioned, the government assistance, the PPP loans, right? Any of you that have dealt with that, you know that took patience, that took know-how. Our accounting department was amazing in making sure that Pink Ribbon Girls could get those PPP loans. We were able to get assistance, the like community grants and things like that, because we were feeding families. If again, those of you that work in that realm know that there was food assistance available. So we were able to prove, right, of how many people we were serving meals to. And that was able to bring in some additional income so that we could continue to serve those meals. Last one that she mentioned is, and I kind of laugh, we continued to host events, not a lot of events. We did it where we felt like we could do it safe. But if you're in the Ohio area, you know about Governor DeWine would give a daily update. We called it Wine with DeWine. And sometimes he would call people out, whether it was somebody that had a funeral or a party, and it became a super spreader. So we would always worry. Pink Ribbon Girls never wanted to be on DeWine's super spreader list, and we weren't, because we did things safely. But again, Heather was determined. If we have people that we can get together safely, we're going to do this, because we have to have fundraisers. And so we did it. And those are really those 5 top things that she pulled out as how we were able to continue to grow. So as we move forward, we talk about, for those just diagnosed, research is too late. And Pink Ribbon Girls provides that essential care now, those things we've talked about, the meals, the rides, the cleaning kits, and the peer support. And one thing I haven't really touched on is how we're partnered with the healthcare systems. I talked about treatment compliance. So we're able with these healthcare systems to make sure that their patients are getting there to them, because the hospital cannot drive patients, right? They have to have community partners that can get the patients there. So we say that we're proud of the 6,211 people that we served, but we're motivated by the 440,000 that we have not. What we're referring to there is last year that we served 6,211 clients, but we know in the cancers that we serve, breast and gynecologic, there's 440,000. So we want to make sure that someday every patient starting the breast or gynecological cancer journey should know about Pink Ribbon Girls and be able to receive our services. But how do we get there? How is it possible? What are we doing to keep growing? We made it through the pandemic, but we want to keep growing. So we must partner with people and organizations that do these, that fall into these three categories. At Pink Ribbon Girls, we talk about doers, donors, and door openers. Doers believe in our mission, and they champion our mission to serve, particularly those with channels to reach clients with food or transportation insecurities. So like when we moved into San Francisco, that was our newest, our most recent region, right? We are going into, hospitals that have high percentages of people that have that food or transportation insecurity, and we want to go in and partner with them. Our donors, again, they have to believe in the mission. They can help us build partnerships that provide sustainable financial support. In the nonprofit world, right? You have to have the donors, but you need those donors that are going to partner with you, that can not only be a donor, but can help you build that sustainable financial support. The third part, the door openers. Again, the most important thing is believing in our mission. They're going to establish relationships within the healthcare community that drive Pink Ribbon Girls awareness, strengthen our credibility, and increase the client intake. So when we go into a region and we make a commitment and we do fundraising, we're going to say we're going to serve this many people. So we have to have that trust from the hospital that they will refer their clients to us, and know that if we say we're going to feed those clients, we're going to drive those clients to their patients, drive their patients to those appointments, we have to do that. We have to be able to make sure we say what we're going to do, and then we make sure that we do it. But those door openers are going to connect us to local hospital decision makers so that they can possibly offer us funding, but then also connect us to corporate partners and connections who have a passion for supporting nonprofits, right? A nonprofit is not just the staff, right? It becomes that whole network, that whole community that is going to continue to dig in, meet new people, find people who are passionate to help this organization grow. So we like to talk about our big audacious goal. When you talk to Heather, she will say, someday, every individual and family across the United States going through breast or gynecological cancer are going to have access to these Pink Ribbon Girl services, the meals, the rides, the cleaning kits, and the peer support, so that no one will travel this road alone. That's our goal. I want you to keep an eye on us, because hopefully you even picked up on it from the video. Heather is, she's a dynamo, and she's not going to be stopped. We want to continue to grow, continue to serve, and someday make sure that anybody in the United States has access to these services. So I'm going to take a moment and give you what I call Jan's personal PSA. One thing I've learned through the last couple of years in my role as Director of Peer Support and Education, and as a 15-year breast cancer survivor, is the importance of your annual screenings. And we know that during the pandemic, up to 90% of mammograms, colonoscopies, your annual gynecologic exams, 90% of those appointments were canceled. Nobody likes to have a mammogram. Nobody likes to do colonoscopy prep. But those are the things that can save our lives. So what I'm going to ask you today is, if any of you listening to this, if you had one of those appointments that were canceled and you have not rescheduled it, I hope if you've heard anything today, it is that you need to get that appointment. A cancer caught early is so much easier to treat or even cure compared to a late stage cancer. So please put yourself first, call and make that appointment, get back into that routine of doing those annual screenings, and talk to your loved ones about it too. If you know that someone in your family has put that off, or maybe they've never done it, maybe they're overdue. please make those appointments. So again, I thank you for inviting me to be a part of your conference this year. Thank you for allowing me to share my personal cancer journey. I'm so blessed to have just celebrated 15 years and thinking a lot about that. I know that I'm right where I need to be, that God put me right here with Pink Ribbon Girls so that through what I learned, I'm able to help others. And I'm part of this amazing organization that we're gonna get there. Someday we're gonna be nationwide. And if you know somebody in one of these regions that could use our help, please tell them to reach out. I know it's hard to ask for help, but we have the resources and we want all of these patients to focus on getting better. So again, thank you so much. It's an honor to speak with you. I hope the rest of the conference was wonderful. Thank you.